Welcome class to chapter 17, diagnostic electrocardiography. This is the last lecture of this chapter where we will be discussing Holter monitors or Holter monitoring. Holter monitoring is the process of recording an EKG tracing from an extended period of time while a patient goes through his or her daily activity. A typical Holter monitor is a small box that is strapped to the patient's wrist or shoulder to record an EKG over a 24-hour to 48-hour period. Right. So these are movable or portable EKGs that monitor a patient anywhere from 24 to 48 hours. They are considered a ambulatory EKG, which is another way of saying outpatient EKG. Holter monitors consist of electrodes and a small battery-powered digital flash memory device into which the rhythm is recorded. The device is small enough to be worn in a pocket or on a strip over the shoulder. It may be used as an inpatient or outpatient, although most often it is used on an outpatient basis. Holter monitors are also known as ambulatory monitors. The Holter monitor is an ambulatory EKG device used to rule out intermediate arrhythmias or cardiac ischemia that might be missed on a routine EKG. As a healthcare professional, you may be responsible for applying and removing the Holter monitor, providing patient education, and ensuring that the results are placed in the patient's chart. You may have to upload the data into a computer so that the computer may analyze the information. These are some indications for Holter monitor use. A patient might experience syncope or near syncope episodes, which basically this is fainting spells, which can be caused by an arrhythmia, which will give it evidence for a Holter monitor to be placed on the patient, because this is something that a normal routine EKG wouldn't pick up. This is something the patient experiences when they're moving around on a daily basis. Intermediate chest pains or shortness of breath, there again is something when they're moving around that's happening. These could be signs of myocardial ischemia, which can be detected with a Holter monitor because it only happens when they're moving around. So, a suspicion of arrhythmias. The patient who complains of palpitation, dizziness, dizzy spells, or skip beats may have arrhythmias that the Holter monitor would show. Determination of arrhythmia treatment effectiveness. If the doctor has diagnosed the patient with arrhythmia, this is to make sure that treatment is being conducted or is being effective. So they will put the patient on a Holter monitor to reveal if the rhythm that they're experiencing is being treated and if it's still occurring as often or not at all. They will also put on a patient on a Holter monitor if they have had an implanted pacemaker to make sure that it's functioning correctly. Preparation techniques for a patient to prepare for a Holter monitor. Patients must be prepared for Holter monitoring procedure both emotionally and physically. It's just something about putting a device on a patient to monitor your heart. They kind of sometimes have anxiety. It's our job as we're placing or as we're educating the patient as to why we're placing the Holter monitor, what is it used for, is to keep them calm and to relax, and to always make sure that they stay calm and relaxed and not experience any anxiety, which can give the Holter monitor negative readings that they wouldn't normally experience. So we also have to, especially in kids, when kids have to go through Holter monitor, when children experience Holter monitoring, it's sometimes it's a scary thing for kids. So we just have to make sure we talk down to their level. We don't use too many big terms, and try to make it fun and exciting for them, so where they won't get scared. All right, so the first step in reducing the fear is to help them understand the procedure. So you want to make sure you explain it clear and concise to them. Try not to use too big medical terms. Try to keep it down to their level. Take time with the patient to explain each step of the procedure as you perform it. So as you putting on the Holter monitor on the patient, just kind of explain to them what you're doing to keep them apprehensive and to keep them mindful as to what are you doing. For children, be sure to explain in terms they can understand. Let the patient know it is normal to have some fear, and to allow a patient to express his or her feelings. Never cut a patient off if they're expressing how they feel. You want to be that listening ear and kind of adhere to their fears, kind of apprehend it, or kind of at ease to it, or ease it up. Allow the patient to ask any questions and answer those questions as completely and accurately as you can. If for some reason they ask you a question that you're not clear and concise with, never say, well, I don't know. Never tell a patient you don't know anything. Always say, well, I'm not 100% positive clear on that, but let me ask the nurse and I'll get back with you shortly. That's how you would say that. So if you don't know the answer, always ask a licensed practitioner or your supervisor for the answer. Never tell a patient you don't know. All right, so we're hooking the patient up. The patient is attached to 5 or more electrodes that are put on the trunk instead of arms and legs in order to prevent muscle artifacts. For male patients with considerable chest hairs, we might have to shave or clip that area to where we can stick the adhesive patches on to them. For a female, we would usually stick the chest leads beneath, but never on top of the breast, because they're going to be moving around. So they kind of have, no matter how secure their bra is, their breasts are still going to move. So we usually put it underneath their breastplate. And the skin is prepped prior to attaching the electrode, sorry. Skin prep usually basically involves that we clean it off with alcohol prep. Make sure they don't have any sweat or lotion so the electrodes can stick to it for a long period of time, because remember, they're wearing this from anywhere from 24 hours to 48 hours. So we got to make sure that those electrodes stay on really good. Let's see. Prior to Holter monitor, the patient must be thoroughly instructed on its proper use. They have to maintain they have to maintain a diary, which is vital for accurate interpretation and evaluation of the results of the EKG tracing. The patient is advised to document any symptoms experienced while on the Holter monitor in a small diary provided for that purpose. By pressing the marker button on the Holter monitor, the patient marks at the point in the EKG at which he or she feels symptoms, so that this part of the EKG can be more closely examined for changes that could have caused the symptoms. Also, we tell the patient that they must not tamper with the monitor or disconnect the leads or electrodes while on the monitor. They are only allowed to take a sponge bath, never ever a shower or a tub bath during monitoring time because the equipment can't get wet because it is battery powered. Remember, it is an electrical device. You definitely don't want them to submerge themselves in water and get and shock themselves. So make sure we are clear and concise. You can tell the patient that they can only take a sponge bath, never ever a shower or sit in the tub while they're hooked up to the Holter monitor. Patients are allowed to sleep in any position that doesn't apply tension on the lead wires or electrodes, so they can sleep normally. They have to be mindful not to have any tension or anything on the leads or the wire or the electrodes. The patient must avoid magnets, metal detectors, high voltage areas, and electric blankets. They can interfere with the tracings because it's all electricity. It's all current. It's just like when we doing an EKG with the EKG machine, we can't really have any electrical devices near us because we cause an artifact in that device. It goes the same thing for a Holter monitor. They can't be around any high-powered electricity. The patient should also know how the monitoring equipment works and be instructed to check that it is working properly during the procedure because we're not going to be with them. It's their responsibility to make sure that the battery is. We check to make sure the battery and everything is fully charged, but anything can happen. It is an electrical device. Technical difficulties do happen. So we have to make sure we instruct the patient on properly taking care of their Holter monitor while it's on them. What do we consider is a positive Holter monitor? A positive Holter is one that reveals abnormalities that could explain the patient's symptoms. These abnormalities might include one or more of the following. It might include tachycardias, bradycardias, pauses, ST segment elevation or depression. A negative Holter has no significant arrhythmias or ST changes. For patients whose symptoms are sporadic, a small device, a patient will carry, and it will basically on that device, it'll be programmed to record any abnormalities that happen in their rhythm, especially when it's sporadic, and it can be activated whenever the patient feels a symptom coming on. So if they feel a symptom coming on, they'll press a button and it'll start recording during that time they're having that discomfort or that particular system. There are two kinds. You have arrhythmia or ST segment activated monitors, which they will monitor continuously all throughout. And then you have the patient activated. When the symptoms occur, they'll press a button and it'll record what during that time that they're having that symptom. It can be carried or worn for extended periods of time, meaning it's not necessarily the 24 or 48-hour period. It may be 72 hours, or it might be a whole week. It just depends on what the doctor is looking for or specifying for. It's also useful in detecting rhythms or ST segment changes that even a Holter monitor might even miss. That's the good thing about the event monitoring. Also, we can catch negative the only negative thing is if arrhythmias or ST changes are not found. This is like the last resort for a patient who might be suffering from some type of symptom, is the event monitoring where the patient controls when it records whenever an event happens. Now, like I said, they do have the one where it can be programmed to always constantly record at any given time, but the most effective one is when the patient can control the event monitoring. So this concludes chapter 17 lecture. If you have any questions or comments, you can text or email me or message me. And this is it. Thank you. Goodbye.